Hello student, let's try to understand power of accommodation of eyes. That is what we need to understand, power of accommodation of eyes. So what is this student? What is this meaning? The eye lens is composed of fibrous jelly-like material. Its curvature can be modified to some extent by the ciliary muscle. The change is the curvature of the eye lens can thus change its focal length. When the muscles are relaxed, the lens becomes thin. Thus, its focal length increased. This enables us to see the distant object clearly. When you are looking at the object closer to the eyes, the ciliary muscle contract. This increases the curvature of the eye lens. Tick. The eye lens then becomes thicker. Consequently, the focal length of the eye lens decreases. This enables us to see the nearby object. Now, what is going to happen? The ability of the eye lens to adjust its focal length is called accommodation. However, the focal length of the eye lens cannot be decreased below certain minimum limit. Try to read the printed page by holding it very close to your eyes. You may see the image being blurred. Okay, you may see the image being what, student? Blurred. Now, or feel strain in the eyes. To see an object comfortably and distinctly, you must hold it at about 25 cm from eyes. The minimum distance at which the object can be seen most distinctly without strain is called least distance or distance of vision. It is also called the near point of the eyes for the young adult with the normal vision. The near point is about 25 cm. The furthest point up to which the eye can see the object clearly is called the far point of the eye. It is infinity for the normal eyes. You may note their normal eyes can see object clearly that are between 25 centimeter and infinity. Sometimes the crystalline lens of the people at old age become milky and cloudy. This condition is called cataract. This causes partial or complete loss of vision. It is possible to restore vision through the cataract surgery. Now, why do we have two eyes for the vision and not just one? That we have to understand, student. There are several advantages of our eyes, our having two eyes instead of one. It gives wider field view. A human being has horizontal field of view about 150 with one eye and about 180 with the two eye. The ability to detect faint object is of course enhanced with the two detector instead of one. Some animal, usually prey animal, have their two eyes positions on the opposite side of their head to give the widest possible field of view. But our two eyes are the positions on the front of our head, and it thus reduces our field of view in favor of what is called the stereopsis. Shut one eyes and the world look flat. Two dimension. Keep both eyes open and the world takes on the third dimension of the depth. Because our eyes are the separated by few centimeter, each eye see significantly different in image. Our brain combined the two images into one, using the extra information to tell us how close or far away things are. Next one we are going to understand, student, defects of vision. This is what our next topic. So this is the what defects of vision, student. Sometimes the eye may gradually lose its power of accommodation In such condition, the person cannot see the object distinctly and comfortably. The vision becomes blurred due to the refractive index of the eye. There are mainly three common refractive defects of vision. These are myopia, nearsightedness, hypermetropia, farsightedness, and presbyopia. These defects can be corrected by the use of suitable spherical lens. We discuss below these defects and their correction. So, firstly, let us try to understand myopia. Student, myopia is also known nearsightedness. A person with the myopia can see nearby object clearly but cannot see the distant object distantly. A person with this defect has far pointed near than the infinity. Such a person may see clearly up to the distance of few centimeters. In a myopic eyes, the image of the distance object is formed in front of the retina and not at the retina itself. This defect may arise due to excessive curvature of the eye lens, elongation of the eyeball. This defect can be corrected by the using the concave lens of suitable power. This is illustrated in figure 12.2. A concave lens of the suitable power will bring the image back on the retina and thus the defect is corrected. Now, hypermetropia. Hypermetropia, also known as farsightedness. A person with the hypermetropia can see distant object clearly but cannot see nearby object distantly. The near point for the person is farther away from the normal near point 125 centimeter. Such a person has to keep a reading material such as beyond 25 centimeter from the eye for comfortable reading. This is because the light rays from closed by other are focused at the point behind the retina as shown. This defect arises either because the focal length of the eye lens is too long, the eyeball has become too small. This defect can be corrected by using convex lens of the appropriate power. This illustrates in the eyeglasses. The converging lens provide the additional focusing power acquired for forming the image on the retina. Next one is presbyopia. Student, the power of accommodation of the eye usually decreases with the aging. For most people, the near point gradually recedes away. They find it difficulty to see nearby object comfortably and distinct without corrective eyeglass. This defect is called presbyopia. It arises due to the gradual weakening of the ciliary muscle and diminishing flexibility of the eye lens. Sometimes a person may suffer from the both myopia and hypermetropia. Such people often acquire bifocal lens. A common type of bifocal lens consists of both concave and convex lens. The upper portion consists of concave lens. It facilitates distant object. The lower part is convex lens. It facilitates near vision. These days, it is possible to correct the refractive defects with contact lens or through the surgical intervention. Now we will do some of the problem students here. Thank you very much for watching.